Welcome to the Registry Insider. I'm Bill Seifert, CEO and Executive Director of the National Registry of EMTs. And today we're talking about challenges facing state EMS officials. And I'm pleased to have three guests with me, three state officials. Steve McCoy from the state of Florida, Mike Johnson from the state of Georgia, and Kraig Kinney from the state of Indiana. So gentlemen, thank you for joining me today to talk about, what are the challenges facing you and your offices and across the country as it relates to state regulators. So Steve, I'll start with you. From your perspective, you've been around for a while. Certainly you've seen a lot of transitions in EMS. What are the biggest issues facing, top two or three issues facing state offices or regulators today?
Well, I think it's, workforce is the biggest issue. You see, it's the hot topic of the day. And when you say, I've been around a while, seeing some things over the years, we've seen workforce come and go. We've seen hills and valleys on the workforce, and we see people create recruitment programs. We're going to start doing things in high school. We're going to start doing these and just repeat the same thing over and over, and then the workforce kind of plays off. And it's kind of like you're treating the symptom of a disease and not treating the disease itself. So the disease in Florida, what I see is a strained system. Mm-hmm. We see a strained system where, burnout's high, mental health's an issue.
Call volumes are high.
Call volumes are, higher than ever. So these are all signs that lead to workforce issues that end up into that symptom. So what we need to do is really look at the system and how it's strained. What's straining the system? Is it low acuity calls? Is it overdoses? These are the things that we really need to focus on to make a change in the system where we don't have these workforce issues. In the state of Florida, we go on 5 million calls a year. Next year, I'd like to go on 4.8, 4.7 after that, and just lower that. And if we lower that strain, hopefully we fix the disease and not the symptom of workforce, where you see what we've been doing so far.
So workforce is clearly an issue, and I'm sure that all of you would agree with that.
Yes.
So, Kraig, from your perspective in the state of Indiana, is there anything that's unique beyond what Steve said, or any other insights you have as far as the problem? And what I'd like to do after we talk about the problem from all three of you is start, what are some possible solutions? Because I know, Steve, you've tried some stuff in Florida. I'd love to hear it. And I'm sure, Mike, you have, and Kraig, you have too. But your perspective, Kraig, from Indiana.
I definitely agree. I think Indiana's similar to Florida, as I assume a lot of states are, and our run volume increased initially before 2020 was around 800,000 calls a year. It jumped up to 1.2 million in 2020, and it is maintained at 1.2 million. So we had that market increase. What I think is interesting, and Steve and I talked about this earlier because Florida is similar, he said, if you map out the total number of EMS licensed people in our states, that number has stayed the same. We can't really say that it has decreased. However, when you look at the need for additional calls, the different roles people are taking, we're trying to do it with the same core numbers of people, yet we haven't really grown those numbers. But it may not all be a shortage in terms of we don't exactly have enough people. It may be a distribution problem as well.
Yeah, that's obviously something that the National Registry is tagged with, in terms of the workforce shortage. Our volumes at the National Registry continue to grow. We were certified more people in the 2023-24 season than ever before. We are higher initial exams and initial certifications in 2023 than ever before. So where are they going? That's what I think. It's a distribution problem.
100%. Because we're certifying more than we ever have.
At a state level, or
at a state level, but we can't keep up with the population increase. Population growing, and the call volume's growing as well.
Yeah, I agree. In Georgia, we've got more licensed EMS personnel than we ever have, but only about 60% of those are actually working in the EMS field.
Yeah,
and so I think EMS has historically worked in EMS, but now they're filling in the work shortages in other healthcare arenas, the hospitals, the physicians' offices, and things like that. And it's just a hard, like they said, the call volumes are going up, but the workforce in EMS is going down, and that makes more problems of lengthy response times, which creates another problem for state EMS officials dealing with that. And how do we fix that?
So workforce is clearly, I would say, just based on I'm hearing from you, the number one issue that all three of you are wrestling with. And I don't think you're alone. I think it's across the country. In fact, I can guarantee you it's across the country, because most of the conversations I'm involved with on a weekly basis have, in one way or another, intersect workforce challenges. So what are some of the solutions? What's some of the low-hanging fruit we can do here? Clearly, as I said, our numbers are going up. Your number of people who are licensed are going up, but they're not in the back of an ambulance side. So what are the solutions that we need to explore to meet the demands, the growing demands? 800,000 to 1.2 million, and yours are growing, and yours are growing. How do you fix this?
Yeah, well, I think we got to start looking at EMS differently. I truly think that the EMS we see today and the EMS we're going to see in 4 or 5 years is going to be a lot different. Mm-hmm. There's going to be more of a focus on the paramedicine models, mobile integrated health. In Florida, we're looking at integrating with MAT therapy in our overdose patients. We got a CORE network, there's a coordinated opioid response network that we have, where we want to start treating these, getting these overdose patients, which that's always going up in most states, and most of my colleagues I talk to is a problem. And we want to get these people in a system of care and start treating addiction as a disease, not as this stigma and how we've been treating it up till now. If we can, and that's a big part of addiction. And mental health is a big piece of our call volume. It's growing.
The practice analysis we did in 2019 and updated in 2021, we went over a 10% increase in terms of mental health and behavioral emergency. So the practice analysis we have is aligned with that too.
And we see it in our data too. We see that growing. So how about we change, instead of just dropping these people off in ER and picking them up a few hours later, let's get them in a system of care that they need to be in.
I think that is key. I think we got to get away, and you mentioned earlier, the lower acuity calls. They really tax our professionals. These are clinicians using their judgment out there. They need a challenging work environment, but they need solutions. And I think the traditional model of someone calls 911, we take an emergency department, that still exists for high emergencies, but there's so many other alternatives, mobile integrated health, transfer to alternate facilities, enrollment in the systems of care. All of those are going to make the profession stronger and keep people in it versus them using it as a quick stepping stone.
Yeah, Mike, from George's perspective.
Yeah, I agree with Kraig and Steve that we're at a crossroads in EMS as we know it. We're only 50 years old,
right? And
I think we're having growing pains, because the way it's been working in the past is not the way it needs to work in the future. And I think, like they said, mobile integrated health and maybe even some telehealth to try to keep these people that really don't need to flood the system in the hospitals, get them the treatment they need through a telehealth model initiated by EMS. And there's a lot of options right now, I believe, that we need to look into to try to solve some of the problems for the future generations of EMS providers.
So in addition to workforce shortage, I think one that I hear often, and I'll just throw it out there, is funding, reimbursement. That is not something that has been resolved or addressed successfully after years of trying. Is that still a top issue, and is it related to workforce shortage? And what are some of the solutions we could do to potentially address this?
I think funding's at the source of all of it. When I get asked, they're like, if you want to fix EMS in one way, I say funding, because I feel like that impacts training, that impacts the workforce, as you said, that impacts organization, that impacts what we can do. And I suspect that we need to look at a quasi model in my mind. I think it still has to be a reimbursement and some type of service program not tied to transport. But I think you also have to look at a tax base in many areas. People hate to say that, but when you look at the successes of the fire service, they are heavily tax-based, and they have overall the equipment they need. They have closer to the workforce they need. than what EMS does, but we are not guaranteed a tax base in every area of the state or even of the country.
Yeah. On the reimbursement side too, I mean, obviously we're seeing some federal bills for treating non-transport for payment of that, which we have to have that. I mean, how can you not pay a provider for, providing on-scene care, preventing that person to going into an expensive healthcare system and not pay the provider that prevented that? We also got to look at things other than reimbursement, like you said, with other models. Like in Florida, we receive money off of moving traffic violations. We get a certain percentage of that. I'd love to see. I see other professions getting $1 on each license plate. We respond to every car that's crashed on the interstate. Might as well get $1 off that license as well. So just creative models as well as reimbursement as well.
Yeah, I think we definitely need to move away from the transport-only reimbursement. And I don't even like the word reimbursement. I like the word fair compensation better. Mm-hmm. Reimbursement means I just get back what I have in it, and there's no way you can function if there's no revenue above what you have in it. So I think a fair compensation model, not based on transport alone, is the way we need to look at.
I think the hidden cost actually in all of it is the cost of readiness too, to make sure you have enough resources available to handle the call volume. And I think a lot of time that readiness, some places you tag it on to the service fee. But when we're doing a fee reimbursement model as it current is, that typically doesn't even cover the one transport, let alone the readiness time that went into factors such as the ambulance cost, the cost of equipment, the insurance, the cost of fuel to get there. All of those factors add up as costs, and we aren't covering them currently.
All right.
So in addition to workforce shortage and reimbursement / fair compensation, I like that term, mm-hmm. What are some other challenges facing you all at the state level?
We're seeing mental health of our EMTs and paramedics become an issue.
So the well-being, mental health, well-being of EMS clinicians.
Yeah, it is. And we get the opportunity during renewal to survey all of our licensees, and we ask questions related to mental health, and it's scary. It is, man. What do we do about it is the question. I think you see some of the things that we see in this industry. It's not a matter of when you're going to see something that may cause mental distress. It's a matter it's a matter of when. Uh-huh. So, what can we do to build resiliency in our new up and coming EMTs and paramedics? We need to. There needs to be a more proactive approach to. Hey, this is what you're going to see. And with the days of, shake it off, you'll be fine. Those days are over. Those days, hopefully, they're over in most places.
I would add too, I think, and it ties into that, I think we need to reevaluate leadership as a whole, because I think that's part of it. The leadership doesn't always know how to handle that. And they just say, hey, I just dealt with it. You deal with it. And I think when you look at, and I believe it's Fitch and Associates EMS Jim's survey, maybe what employees want. When you looked at why people were leaving, pay was not the top one. Well-being was high up there, but leadership is usually the top aspect in the past couple of years. And we don't train our leaders and give them the tools. We promote from within, which is nice, but we assume that they can figure out how to do a budget, that they can communicate effectively, that they can understand well-being, and we've not trained them properly on that. And I think we have to see improvements in educating and creating a leadership pathway so people can be better trained as they promote.
There's a plethora of evidence supporting that too. I mean, I'm thinking of the American Ambulance Association survey too that showed poor leadership as a reason for leaving EMS. And certainly some of our research team here at the National Registry is focused on reasons for leaving, poor leadership, burnout post-COVID. It's multifactorial. So I'm hearing there's a lot of issues and a lot of challenges facing state offices. Are there any others that care to bring up that are top of mind for you, Mike or Kraig?
Education for me is one I thought of before leadership, and yours was a natural segue, Steve. But I think education, we get this balance. We're pushed more and more to get people produce more rapidly. We want to fill these seats, cut corners, get it here. But on the other hand, we as a profession want clinicians that are adequately trained, and the platform we're sitting in, the National Registry, guarantees a national competency. And we can't get away from those values. We still have to have quality clinicians that are properly trained and are qualified to be out there.
Yeah, and retaining those people, it's much easier to retain them, I think, that we need to work on other than replacing them every 5 to 10 years. So retention of a qualified, verified workforce, I think, is crucial. And a lot of that has to do with the mental well-being and the burnout and things like that.
I did hear a suggestion, and trust me, I'm opposed to this, but this was an interpretation. They said, is EMS truly a profession, or do we just accept that it's a stepping board and we're only going to have people for 3 to 5 years and we're going to lose them? And I hate to get to that point, but that was an observation based on the current circumstances that seem to be happening.
So challenging times in EMS. I don't think there's any question there, from workforce shortage to reimbursement to well-being to education and retention. They're pretty much all the issues that we had. I think there's unfortunately more problems than we have solutions.
Yeah, exactly.
That's a reality. So I think the challenge that we need to accept is the more we become closer in one voice in EMS, the better a lot of these problems are to solve. But it is challenging times. I think we need to acknowledge that, respect that, and work together in one voice to address them. So, gentlemen, I thank you all for joining me today to talk about what's top of mind in terms of challenges facing State EMS offices. I appreciate what you do from a regulatory perspective and the systems approach to EMS and serving each of your respective states and the nation through the National Registry. So, thank you for joining us. Please stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications about upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.